This is Sancheti Hospital Bone and Joint Hour on 94.3 Radio 1.
सुन रहे हैं आप 94.3 रेडियो 1 एंटरटेनमेंट का बाप। मैं हूँ आपकी लड़की कमाल आरजे मीनल। चल रहा है संचेती हॉस्पिटल बोन एंड जॉइंट आवर। संचेती हॉस्पिटल महाराष्ट्र का नंबर 1 ऑर्थोपेडिक हॉस्पिटल है, इंडिया का नंबर 2 ऑर्थोपेडिक हॉस्पिटल है, और अब संचेती हॉस्पिटल ने शुरू किया है अपना जेरियाट्रिक्स विंग भी। मेरे साथ हैं जेरियाट्रिक स्पेशलिस्ट डॉक्टर अदिति मालपानी। डॉक्टर, वेलकम टू द शो।
Thank you so much, Meenal.
सबसे पहले ऑफ कोर्स बिफोर वी स्टार्ट टॉकिंग अबाउट द डिपार्टमेंट, जरा आपके बारे में बताइए, कितने सालों से प्रैक्टिस कर रही हैं आप?
I'm practicing here at Sancheti for more than 10 years.
Oh wow, okay. और ये बताइए, what made you interested in geriatrics medicine?
Yeah, so I've been practicing last so many years, like more than 10 years.
Right.
But now in last few years, everywhere we see and here also,
Right.
more and more elderly patients are being admitted and even getting treated and surgeries being done.
Right.
The elective surgeries are being done.
Correct.
Elective surgeries, I mean to say the spine surgeries, the knee replacement surgeries, hip
Right.
replacement surgeries.
Right.
So like in a trauma department, any age group of patients can
Right.
come.
Right.
But with so much of increasing life expectancy, so many elderlies beyond even 70 and 80 years
Right.
are getting operated.
Wow.
So I think optimizing them, treating their medical conditions like peri-operatively, and I think beyond discharge also and at home also, it is very essential.
एब्सोल्युटली, बिल्कुल सही कहा आपने। एंड डॉक्टर मालपानी के साथ हम जरूर बातें करने वाले हैं अबाउट जेरियाट्रिक्स मेडिसिन दिस वीक। और ऑफ कोर्स अगर आप एक केयर गिवर है, यू शुड डेफिनेटली लिसन वेरी अटेंटिवली। डॉक्टर, जरा बताइए, स्पेशली आई अंडरस्टैंड दैट बेबीज हैव सेपरेट डॉक्टर्स एंड नो सेपरेट मेडिसिन फील्ड, लेकिन जेरियाट्रिक्स के लिए क्यों एक सेपरेट केयर होना चाहिए?
Geriatric, it is a specialty that focuses on the healthcare of elderly, and more so there cannot be a definite age to separate them, but it's like more than 65 years of age.
Achha.
So I would prefer to call them more than the elderly, maybe an older adults.
Correct.
People listening to this also will be more happy to
Right.
listen then. So it is a kind of holistic care service where the more emphasis is on the maintaining of the function of the patient.
Correct.
The functional abilities of the patient needs to
Right.
be maintained, needs to
Right.
be improved even after the surgery or even after some acute emergency like critical
Right.
ICU admission or any kind of illness for that matter. So it aims on improving the quality of life for the people,
Right.
not only treating them and managing their illnesses.
Correct. आपको लगता है कि द डॉक्टर्स दैट आर इन्वॉल्व विद जेरियाट्रिक्स मेडिसिन रिक्वायर सर्टेन अमाउंट ऑफ काउंसलिंग एक्सपर्टीज ऑल्सो इन अ वे, बिकॉज द अदर्स मे बी बिकॉज पेशेंट्स आर मच स्ट्रॉन्गर व्हेन दे आर यंग अडल्ट्स, व्हेन दे आर अ लिटिल अडल्ट, दे नो व्हाट्स हैपनिंग टू देम, बट विद जेरियाट्रिक्स यू नीड मोर स्पेशल सॉर्ट ऑफ काउंसलिंग एज वेल?
Yeah, I think the counseling part, talking to them, giving them time, explaining them what has happened, why it has happened, how it is going to recover, what is going to be the outcome, it is
Right.
very important. And it is important for the patient also to know it, for the
Right.
caregivers also, for the family members also.
Correct.
Because I think in this age group, it's not only writing those 4 or 5 medications, the treatment goes beyond that.
Correct.
We need to see how the resources are available to the patient,
Absolutely.
how accessible the healthcare is.
Right, right, right.
And of course there are too many psychological issues in this age
Correct.
group. There are some social issues, economic issues.
Yeah.
Patients the person might be living alone.
Correct, correct.
So loneliness issues, even
Right.
the suicidal tendencies we see more.
Yeah,
And
yeah.
at the other hand, when even a patient is staying with her or the person is staying in the family, we do see cases of abuse, some neglect
Right.
and ignorance.
Right, right.
So it is very important to go beyond the treatment and manage
Correct.
all these issues.
Absolutely.
So counseling, of course, it forms the big part of the treatment.
एब्सोल्युटली। संचेती हॉस्पिटल में हम बातें कर रहे हैं विद डॉक्टर अदिति मालपानी। चल रहा है बोन एंड जॉइंट आवर विद संचेती हॉस्पिटल। वी आर गोइंग टू बी टॉकिंग अबाउट द वेरियस एलिमेंट्स एंड कॉमन एलिमेंट्स व्हेन इट कम्स टू जेरियाट्रिक्स। अगर आपके घर में आपके माँ बाप हैं, यू थिंक दैट दे आर सफरिंग फ्रॉम समथिंग, ज़रूर सवाल पूछेगा। 7755 943 943 इज़ द नंबर।